Yeah, and you alluded to it. So you did some work at UNICEF as a consultant for the educational program for development. Tell us about that work.
Yeah. Well, actually, I was in my doctoral thesis. I was already with all my work done in the doctoral degree, but I was just writing my thesis when I went to live in Belize. And that was very interesting because I spent there like a year and a half working with UNICEF as a consultant. And I was asked to write the situation of the women and children in Belize. UNICEF does this every 5 years in every country. So that was fascinating because that was actually my first encounter with the practice of public health. You notice that until now, I didn't say I didn't study public health, right? So I came to public health from my educational background. So my first encounter with public health was in the practice of public health was actually in Belize, working with UNICEF. So when I was writing the situation of the children and women, I really was shocked to see the scarcity of many communities around the country and how the social determinants of health shape their future and destiny. And that really broke my heart because I said that, I was in Gallaudet before, right? So I saw how when you have, the possibilities, when you have the tools, when you have a supporting environment, you thrive. But then I was able to go to exactly the opposite thing, right? When you don't have anything, right, for the kids. So it doesn't matter that the kids, they were not special, with not special needs, but they do have such a scarcity of resources that they were so limited. So they didn't have education, they didn't have enough food, they couldn't have a school close to their houses. So then I really was more moved toward understanding how the social determinants of health can really mark your life and your future. So I think that that's when I really started to really understand more how the social determinants of health can really determine like your future and of course your health. Yes. So
Well,
that's what I did
yeah,
there.
love that. And it's always cool to see like how people get introduced to public health or public health concepts, because many times we kind of like have a feeling for the disparities and inequities and social determinants of health, but we just don't have the words to describe it. So and that, I always think it's interesting to see how that develops in people's journeys.
Yeah, absolutely.
Awesome.
Mhm.
And then after your PhD, you worked as an executive director at the Mexican North American Institute of Cultural Relations and the dean of the School of Education of the Universidad de las Americas.
Right.
Tell us about that experience. How do you get there? What do you do?
Absolutely. Well, you know what? I think that really life is a journey, right? So the important is not the destination. We always think about, oh, when I graduate from here, when I do this, when I do that. But really, now that I'm looking back, like at 40 years of life, it's really you see your life as a journey, right? So everything you do builds up and influences what you are today. So of course, any journey, you have ups and downs. Sometimes you win and sometimes you learn. I love that phrase
Hmm.
because you always learn, right? So I like to also think about life as a marathon. It's not a sprint; it's a marathon. So you're here for the long run. So you go through life really taking the opportunities that life brings you, getting out of your comfort zone, which I have repeatedly done over all my career, because you can tell that I was in one path, and then all of a sudden, like life and the opportunities reached me and said, and I was like, oh my God. And you're going to see a little bit more like when I get to actually to public health. And it was totally out of my comfort zone, right? But I did it. And and that's one message that I want to pass to your audience, because I think that sometimes we get very comfortable where we are, right? And we're really doing a lot of great things, and that's awesome. But you cannot grow if you don't go outside your comfort zone. You have to risk. And actually, I did that several times in all my career. And then you need to create the future you want for yourself too. So in my case, really all my previous positions really have impacted me who I am today, right? I like to think that I have here my toolkit, and I always have like, what do I need for now? What do I do? How do I develop this resiliency or this communication skill or this whatever? And then you look back, it's oh, at that part and that point. So yes, those at that time when I came back from UNICEF, I continued my career as a leader, but now in more academic situation, like in the University of the Americas and also in the Cultural Institute. So I was just continue, I'm guessing my career as a leader in education, I would say.
Love that. And what were some of the roles that you did as the executive director?
Well, I was we had students, so recruiting students all over the world, and we were training the faculty as well, and of course doing a lot of cultural exchange opportunities between at that point with the Mexican American with the United States and Mexico in the Cultural Institute, and not only students but also artists and a lot of the cultural that that passes around the two countries. Mm-hmm.
And maybe to backtrack a little bit, so coming out of your PhD program, maybe what were some of the ideas of the career or the work that you'd be doing when you were coming out of your PhD program?
Well, I was just more concentrated in the leadership position as opposed in what's the field. And because I always love education and higher education, I think that I have always had like this one foot in the higher education space because I love to work with students and with the faculty and just to continue in higher education. So I think that I just went back to some opportunities in higher education. I think that I had, yeah, that's what marked, I think, all my career.